And we're talking about fasting. Wow, that amazing tool that we have been using to put our diabetes in remission, to get off of diabetes medications, to improve our metabolic health, in fact, to reverse our diabetes. I'm talking to adults with type 2 diabetes who want to reverse their diabetes. That's right. That's what we're working on right now, type 2 diabetes and reversing it. Hey, if you're new to me, I'm Dr. Dwain Woode. That's Wood with an E. The E stands for endocrinology. Here on the channel, I educate, I empower, and I encourage you to take charge of your health and your life, avoid complications, and go to the next level. And in this year, new year, new you. Thank you for joining us tonight as we move through another fasting phase, right? So I am now 73 hours, a little over 73 hours in my fast for this week. As you know, we started the year by talking about developing a new attitude, a new process, a new way of thinking about our metabolic health. And that's what we're going to be continuing to do tonight as we move through this process. We'll come back and we'll talk more about that. But so glad that you're here, whatever platform you're joining us from, whether that's here on YouTube, Facebook, Instagram, or LinkedIn, or TikTok, or Twitter, any place that you're finding us, or Twitch, actually. Let me add that one in there. So glad that you are out there and that you are joining us. All right, so let's go back and let's go through. And you heard me kind of giving that pitch there just a minute ago as we walk through, hey, what's going on here on the channel? Well, several years ago, let me say that, years and years ago, I was diagnosed with type 2 diabetes. And I was diagnosed right as I was about to start medical school. And in the process of going through medical school and going through residency, and then going through a fellowship, and then beginning to treat patients, I handled myself and I treated my patients the way I was taught to manage diabetes. And notice the word I used. I was taught to manage diabetes, not to reverse diabetes. And in fact, it wasn't until recently that the American Diabetic Association came out with criteria for what they called putting diabetes in remission, okay? A word that we've kind of coined and said, okay, we're the word that we're going to use is reversing. And you may hear a lot of people talk about reversing diabetes. And as we were thinking about how to improve my personal health, and as I began seeing patients, and not began, but as I saw patients over years and years and years, realizing that the old model, while it did the things that we wanted it to do in terms of managing diabetes and in terms of improving blood sugars, it didn't go all the way. And we were still having significant complications. In fact, around the world right now, there are over 1 billion, that's billion with a B, people who are living either with prediabetes or with diabetes. That's 1 billion. And the numbers are continuing to go up, and the complications are continuing to go up, and it doesn't seem as though there is an end in sight. And so I began thinking about myself and my health, and as I talked to my physician and began to do research and began to read and began to think about, okay, how do I do things differently? The New Year, New Model, New Year, New You model was born. And within that model, we began thinking of what are some of the tools that we could use to help people in their everyday life. Because if I can give you back the power, if I can give you back the control, the ability to make decisions, then we're giving you back the power. You've heard me talk about unlimited potential, the unlimited potential that you have at your fingertips to make change, to improve your metabolic health. And part of that is with the fasting. And so fasting is an amazing process. And before we get into that discussion, let me go and do like you know how we do here on the channel. I've got my meters that we're going to take a look at here in just a minute. I've got those off to the side. I've got my report that's right down below. And we're going to take a look to see what my monitors are showing in terms of what my blood sugar is and what my blood sugar has been doing over the course of today. And in fact, we're going to look back and see what it's been doing over the course of the last several days, that monitor that you're seeing right there down below. Okay, so let's go ahead and let's hop over there. Well, first, let me do my check-in to let you know how I'm feeling and how things are going as we move through the course of this fast. And as you heard me say, that I am actually now a little over 72 hours, actually a little over 73 hours in this week's fast. I normally start the fast on Tuesday, do a check-in on Wednesday, but I actually started the fast this week. I started it Sunday night or Monday morning, and so we are now 72 hours, a little over 72 hours, as I said, into that fast. So let's talk about how I'm feeling as we do our check-in. And, you know, as I always talk about, there are three places or three areas where people can run into issues, and there are physical, mental, and emotional. So let's run through those together. So physically, when we talk about fasting, people typically will talk about their energy level, talk about things like being lightheaded, dizzy, sweaty, and so forth. And I have to say that lightheaded, dizzy, sweaty, palpitations, I've not had any of those. Those are pretty uncommon for me. I have had occasion, if you heard my check-in last week, where I did feel a little lightheaded, and part of it, I'll talk about that here in a minute. Part of it was not getting into the fast the way I should have. Okay. Physically, my energy is feeling good. This afternoon at work, I was, we came back from lunch. The team had eaten, and so I'm sitting there, and I'd seen kind of my last patient. I think we were waiting for one more patient to come in, and I'm sitting there, and I began to feel a drop in my energy. Okay, so usually that's not a big deal for me, but I felt a drop in my energy, and I actually had to get up, and I walked downstairs, came back up. Patient was late, and so I, came and I sat and I talked to some of the team, and that walking that I did actually helped me to get a little bit more energy up. And I'm not quite sure what caused that drop. Perhaps it was going to bed late last night, but that was a different feel for me during the course of this week. That's not usually something that I see. I can tell when I'm fatigued, which is usually, it feels different, but this one was, I could tell that my energy level had somehow changed at that moment, and going and walking kind of helped with that. So physically, that's where I am. And then we talk about how I'm doing mentally. So the mental part of fasting, and remember, fasting is not just a physical thing. It is a physical, mental, and emotional. That's why I do the check-in on all three of these. So mentally, I'm not feeling sluggish or foggy. During that time when I was feeling drop in energy, I actually felt like I wanted to sleep. As a matter of fact, one of our team members looked outside, and it rained this afternoon. When I say rain, it poured. And so, the skies became dark. We heard the rain as it hit the window as we were sitting there in the office. And I think part of what I was feeling was that. And during that period, I may have felt a little sleepy. And as you're sleepy, sometimes you're not thinking well. And so when I got up, walked downstairs, came back up, then I was clearer. I had more energy. Was able to engage. And so just that act of moving actually helped me through that process this afternoon. And then emotionally, this has been actually a pretty good week. Coming out of last weekend, not a lot of stressful events going on during this week. This is pretty much a pretty chill week. Last night, I came in and I was planning to do a video, but I decided not to do that video and hung out with my son, with my wife. I actually fell asleep on the couch in the family room, and then got up, put my son to bed. Talked with him. He's 15, so necessarily putting him to bed, but you get the idea. But I usually talk with him before he goes to bed. We have a conversation, we pray, and then I went and I slept, and then woke up this morning. So not a lot of things coming out of the weekend that were very emotional, and not a lot of stressful things going into the week that were very emotional. And so this week, emotionally, I actually felt pretty good. Excited to get into the week, and excited to get into the weekend that's coming up, because we've got, as I told you, we have some things that are coming up here in another several weeks. We got a big camping trip and so forth, and so just kind of getting ready for that. The anxiety, not anxiety, but the excitement is beginning to pick up, and so just very very happy to be in that space. So emotionally, actually feeling pretty good. So let's go ahead, and I want to hop over, and I'm going to take a look at what my Libre is saying. And so this is my Libre monitor, and you see that there on the screen. So my Libre is saying that my blood sugar right now is 62, and that is a 62. If you look at the graph down at the bottom, you'll see that for maybe half of the day, I've been running below 60, or below 70, sorry. The bottom of that green is actually 70. And if I, let's take a look at what my Dexcom is saying. And so Dexcom is saying that over the last 24 hours, we've been kind of hovering right above 70. If I change that to 12 hours and then maybe 6 hours, you'll see how much closer to 70 that is, okay? And then, as you know, I have off to the side here, I have my Keto Mojo meter, which gives me a blood sugar and a ketones. And then also I have here the Contour, which gives me the blood sugar. So let's go ahead and let's do that right now, so we can begin comparing those to see where they are with respect to what my monitors, my CGMs are saying. So let's go ahead and get a strip out for the Contour. And we'll get that one in there. And then we'll start, as I normally do, with a strip for the Keto Mojo, the blood sugar strip. And then we'll come back and do the ketones. So get that one in there. Okay. And the Lancet, typical Lancet that I like to use the Unisticks. They are spring-loaded. Use them once, and then they go away. You throw them away. And so basically, you break this top part off, right? And that just pops out. And then when I press this lever, then the Lancet will come out. I get a poke on my finger, and then we'll get a drop of blood. So I'm going to go ahead and hold this one up, so you can hopefully hear. I'm not sure if you heard that, but let's see if I have a good, yep, that gave me a good drop of blood. So let's go back over here. So we've got a good drop of blood there. And so let's go ahead and put that onto the Keto Mojo, and then over here to the Contour. Okay, we'll see what those are. So Keto Mojo says 64, and then the Contour says 67, 64, 67, and then you'll recall that the Libre said 62, or now 61, and then the Dexcom said 73. So 61, 64, 67, and then 73 is what we're seeing right now. So I'm going to go ahead and take the strip out for the blood sugar from the Keto Mojo. We'll open up a strip for ketones. And then let's go ahead and apply that drop of blood. And of course, like I always do, I'm going to not tell you guys what that is. Hop back over here. We'll come back and we'll look at that here in just a minute. So let's hop over and let's talk about our topic for tonight. And the topic tonight has to do with the power of fasting. Okay. And remember that I am over 72 hours now, say over 73 hours and 19 minutes in terms of my fast. Um, and so I guess the backdrop of this conversation has to, of course, talk about why I do what I do in terms of fasting. Okay. And you may be out there and you're asking that question as well. Why are you fasting? And what does fasting do? We'll talk about what fasting does here in a minute. But the why of fasting has to do with what I just described in terms of my training and the places I found myself in dealing with patients. Okay. So when I went to my physician, and he said to me, "Hey, Dwain, what is really going on?" Right. So I'm the endocrinologist, and we're having conversation, and the question seemed to imply, as he was asking the question, is what we're doing isn't working, and you're the endocrinologist, right? How do we continue doing what we're doing when it's not giving us all the results that we want? Do you understand the question that we were both asking? Right? So we were both asking this question about, well, what is the end product? What are we looking for? What are we doing? What are we planning? And to go to this question, let me tell you a quick story. And in fact, I see a little glare on my glasses. Let me change those out because I have on some different ones. But let's do this. Yeah, I think that'll work better. Okay, there we go. And so when I was a kid, my mom would say, "Clean the house," and she'd go to work, and she would be gone. And when she came home, was the time when we cleaned. It wasn't like we were out there cleaning while she was gone. It wasn't until she was coming home that we're like, okay, now it's time for us to clean. And so we would run around the house and we would clean up, and we would do a good job. So she would walk into the house and the house actually looked pretty good, right? So she couldn't tell, well, at least we thought she couldn't tell what was going on all day while she was away. And so the house looked clean. So the floors were clean. It looked swept. There was nothing on the counters. But if she went into a closet, then, or she went under the bed or into a drawer or somewhere, then all this stuff was there, right? Well, the treatment of diabetes is kind of the same way. So we can lower your blood sugar. We know how to do that. We have medications to do it. We've talked about it. We can lower the blood sugar. We can get a good A1C. But the question that we've got to ask is, the blood sugar is good, but where did the sugar go? Like, there's no magic. I mean, it didn't just poof away, did it? Right? So there are all these complications that can come up as a result of the way that we treat diabetes. And so as I started looking around and starting saying, okay, what do I do personally for my health? One of the things that I kept running into was this idea of fasting. Now, I'll tell you, going back in the history of medicine, we did not really give a lot of credence to fasting, right? In fact, we told patients a lot not to fast. In fact, there are many of you out here who are listening to me, who are watching this, who you're like, my doctor has told me that I couldn't fast. I'm a diabetic. I can't fast, right? Because that has been the kind of thought. So I fast because it is a tool. One